Hi, Professor. My name is Cynthia. Today we will have a final presentation on the patient data. So the agenda will be introductions and some analysis of the patient data and insights. Lastly, I will present the conclusion. So first of all, meet the data. So the data we get from was a patient data that professor upload to the Gap for us to download it. And the data processing, we usually read the data or insert it into a program called R. And by then we summarize such as patients counts, complications, or monthly totals are created using functions like table or a graduate or other code terms. So some of them are also plotting with ggplot2, a powerful and flexible plotting system in R. And lastly, I am adding labels and theme to better clarify and presentation and visualize overall. So the target audience we have from the data is male patient, which we use letter M, and female patient, which we use letter F, that we will present in the graph. So when we look at the first graph, patient count by gender, and from the pie chart and the bar chart, male have more than double the proportions of the patient population, which M equal to 124 and F equal to 51 of populations. Secondly, if we look at the gender distribution, the plotter scatter plot here illustrate the numbers of male and female patients indicated that the males contribute a significant larger portions of the patient population, which aging from around early 20s to the age 60 or above. So the gender imbalance is represented in the above pie chart as well, because you can see the percentage of male is 71% compared to female patient, which is 29%. And from the scholar chart, the blue dots, which is male, were a lot more scalar than the pink dark. So when it comes to the histogram of hospital stay durations, it summarized the distribution of hospital stay durations across all patients. And the histogram reveals a high right skew distribution where the majority of patients were hospitalized for fewer than 10 days. And you can see from the bar here, it was really high over here, less than or fewer than 10 days. And there is a steep drop in frequency as the length of stay increase. So there are very few patients remaining in the hospital beyond 30 days. That's why you can see lots of empty space here. When it comes to the bar chart of hospital stay duration by gender, you can see there is a lot more blue bar here, which represent the male populations, and it present a side-by-side comparisons of hospital stay durations for both male and female patients. The chart demonstrates that the majority of patients, regardless of gender, stay in the hospital for fewer 10 days, if we combine them. But also, male patients represent a higher concentrations in 1 to 5 days, which there is a sharp drop off in frequency beyond after 15 days. And female patients in pink show a little bit more trend, but it's lower count overall since the blue drops and you can see a little bit more the pink bar. And the distribution for both genders positively skewed with a fewer aligners expanding into longer stays. So when I work on hospital stay duration by gender, it represents a side-by-side comparison of hospital stay durations for men and female again, but this is in a form of side by side without overlapping, and it also shows clearly that male patients had a lot more than female patients that stay less than 20 days, and it in here we can see clear numbers of 59s on less fewer than 10 days here. So when it comes to histogram of hospital stay duration, combining both male and female, we can definitely see the histogram reveal a heavily wide-skewed distribution with most patients, 76, staying between 5 to 10 days. And this is followed by 40 patients staying between 10 to 15 days and 22 patients in the 15 to 20-day range. The frequency of longer hospital stays dropped immediately after 20 days, with solely isolated 1 days around 50, between 50 to 80 days. So lastly, when we look at the monthly hospital admissions, the chart illustrates the numbers of hospital admissions per month over a 14-month period, spanning from November 2021 to December 2022, and the trend shows a dramatic increase from December 2021 to January 2022, reaching a peak in January and slightly decreased to 26 in February, and again it decreased to 19 by March, slightly go up in May, and uh, mostly going down again in May, and going up in June, July, and a drop in August, September, and a slowly decreasing from October to December since then. So here are all the graphs that I have been working on in R with the patient data. And in conclusion, there are a lot more male patient to female patient, and the bar summarize all the patient's data, and it has been a fun experience using the program. So thank you so much for listening.